Hi, my name is Duncan Skerrett. I'm a second-year medical student at the University of Washington School of Medicine. And this presentation is on a research project that I worked on in the UW Department of Orthopedics entitled Displacement of Femoral Neck Fractures on Orthogonal Imaging Strongly Associated with Failure of CRPP. Now, what does that mean? This is a project on fractures of the femoral neck, and specifically fractures that were treated with closed reduction and percutaneous pinning, or CRPP for short. Now, CRPP is one of many operations in a surgeon's repertoire that can be used to repair a femoral neck fracture. The basic decision point when deciding which operation to choose is between replacing the hip, so arthroplasty, and there's a couple ways to do that, or using screws to screw the fracture back together and allow it to heal. And CRPP is one way to do that. In general, there's a few factors that you consider when deciding whether to use arthroplasty or screws like CRPP. And those include things like bone quality. They also include whether the fracture is displaced or not. In general, a displaced fracture, in layman's terms, like a worse fracture, is more likely to be treated with arthroplasty than a non-displaced fracture, especially in the elderly population. But many fractures in elderly patients, many femoral neck fractures, that are displaced are still treated with CRPP. So in this study, we were looking at, okay, well, if a fracture is displaced and treated with CRPP, is that fracture more likely to fail treatment than a fracture that is non-displaced and treated with CRPP? So we looked at the Harborview Trauma Database from Seattle and found several hundred patients in the past 10 years who had suffered a femoral neck fracture and were treated with CRPP. And specifically, we were looking at elderly patients. As far as our, we also had to define treatment failure, and that was defined as avascular necrosis, non-union, or conversion to arthroplasty. And we had a number of possible predictors of treatment failure, and these included displacement, which was kind of the main predictor that we were looking at. And that was assessed on orthogonal imaging, which you see in the title. And what that means is both the AP and the lateral radiographs of the hip were used to assess whether the fracture was displaced in any direction. We also had a number of other demographic factors that we collected as possible predictors of treatment failure. Chi-squared testing was used to assess correlation between these possible predictors and treatment failure. In the middle, you can see the results. Non-displaced fractures are in purple in both the survival curve and the pie charts, and displaced fractures are in gold. So you can see in that bottom right pie chart, displaced fractures were overrepresented amongst the fractures that failed treatment. And you can also see that kind of downward trend of the displaced fractures on the survival chart. And what this appears is that displaced fractures are failing early and often. And in fact, the chi-squared test bore this out and found that displaced fractures treated with CRPP were significantly more likely to fail than non-displaced fractures treated with CRPP. We also found an association with absence of dementia and CRPP failure. None of the other possible predictors were associated with treatment failure. The major conclusion that we came to based on these data was that in elderly patients, displaced femoral neck fractures are significantly more likely than non-displaced fractures to fail treatment with CRPP. There are some caveats to this. This is an observational study, so there are possible confounding variables, including in many cases, a patient who has comorbidities might be a poor operative candidate for an invasive procedure like an arthroplasty. So a surgeon might select CRPP knowing that there is a risk of failure and that patient's comorbidities may increase the risk of the treatment failure. And so that is a confounding variable. As far as the absence of dementia goes, confounders include differing goals of care of patients with dementia, as well as decreased ability of patients with dementia to communicate with caregivers. Possible future studies could further look into this potential association of absence of dementia with CRPP failure, as well as looking at some other radiographic factors, such as the degree of posterior angulation as assessed on lateral radiographs and CRPP failure for fractures of the femoral neck. I'd like to thank Dr. William Lack and Dr. Max Cole for their guidance on this project. And thank you for listening.